Dear colleagues, today we will talk about influence of age-related factors and influence on pharmacokinetic, gender difference in drug metabolism, ethnic variability of drug effectiveness. It's second part of lectures concerning on different efficacy of drugs, different doses of drugs, and how it's working in different population, include taking into account ethnic variability of drug effectiveness. What's important? This new knowledge, which are now very actual, because we see mixed marriage and expectedness of efficacy drugs and toxicity of drugs can be different. It's why very important to conduct clinical trials in territory. Plus, remember that there are different types of metabolizers, poor metabolizers, rapid metabolizers, and different another types. It's influence of influence on efficacy of drugs too. For our new participants, I would like to introduce myself. My name is Galina Cardera. I am qualified person for pharmacovigilance, head of pharmacovigilance department, clinical expert DCK.Pharmac, and who would like to get new knowledge. I will share it with you, share my experience, my skills, because we met similar situation and medication errors and previously problems with drug-drug interaction, because now too many new drugs. We will talk about it in my future lectures too. Plus, I will be very thankful if you will subscribe to my YouTube channels, Drug Safety from Galina Cordero, and to my website, allmedicine.net. Plus, if you have any question, be open and contact me. Send me your question concerning on your needs in drug safety field, in pharmacovigilance field. Now I'm working in book. I'm working because clinical aspects of pharmacovigilance are very important. Patient is first, and you will see it very soon. I will provide you draft. Who will want to buy will contact with my partners, Bioscience and Nova Medical, the Pharmacovigilance Universal and Medical Affairs School too. I work with them, and it will be great books already in stage of preparation. I am look forward basic course of pharmacovigilance, plus book of pharmacovigilance quality system. Plus, I think I will write a practical guide for QPPV. You can attend my webinars 21st of November. It will be practical guide to QPPV, skills, requirements, knowledge, and discussion, practical situation, practical scenario with it will be seminar, webinar, and workshop. And 28th of November with standard technology development. It will be webinar concerning on pharmacovigilance quality system. One day it will be a webinar and another workshop. This format will be very suitable for you, because not just theory and practical situation will be discussed with errors and how to solve it, which we meet in real situation, and experience and advice from regulatory authorities, very important too. Today it will be, as I said before, second part. I divided it because topic is very important, topic very deep, and needs academic knowledge, not just drug safety, pharmacovigilance, but genetic and deep genetic knowledge, like we discussed before, how a genetic factor influence on efficacy of drugs and doses and types of metabolizing can influence has influence too. Influence of demographic factor of drug response is age related pharmacokinetics. Age can affect drug absorption, distribution, metabolism, and excretion, necessitated different dosing strategies for pediatric and geriatric population. Gender difference in drug metabolism. Biological difference between genders can lead to variation in drug response, requirements, consideration in gender specific dosing and treatments plan. Ethnic variability in drug effectiveness. Ethnic groups may exhibit different responses to medication due to genetic, environment, and cultural factors, emphasizing the need for tailoring therapy. Demographic factors influencing drug response, its age. We talked about before, and now we will talk concerning on pharmacokinetics and dosing consideration. Pharmacokinetic age-related physiological changes affect drug absorption, distribution, metabolism, and excretion. Pediatric population, infants and children have immature liver and kidney function, affecting drug metabolism and clearance. Dosing in pediatric is often weight-based. We talked before, and I again make accent on it to ensure a safe and effective treatment. Geriatric population, older adults experience declines in liver and kidney function, reducing muscle mass and increase in body fat, which can lead to prolonged drug half-lives and increased risk of adverse effects. Dosing consideration: start with lower doses in children and the elderly and gradually adjust as needed, closely monitoring for efficacy and adverse effects. Regularly review medication in older adults to avoid polypharmacy and reduce the risk of drug-drug interaction. Sex, taking into account gender, hormonal difference, sex hormones, estrogens, progesterone, testosterone affect drug metabolism, particularly enzymes like cytochrome P3A4, which metabolizes a wide range of drugs. Body composition: women typically have a higher body fat percentage than men, impacting the distribution of lipophilic fat soluble drug which may stay longer in their system. Differences in drug response: pharmacokinetics: women may have slower gastric emptying times, affecting drug absorption, and pharmacodynamics: some medication opioids may produce stronger effects in women due to sex-specific receptor distribution. And dosing consideration: for some drugs, especially those with narrow therapeutic windows, sex-based dosing adjustment may be necessary. Women may need lower doses or altered doses schedules for certain medication, especially during pregnancy or hormonal fluctuation. Um, Ethnic variability mechanism drug effectiveness with different population. We will talk how it's working in different races, in different population. Why? And because you can meet, it will be news for you that different population has different genetic variation plus variation which are characterized just for this nation, for this population, for this race. For Caucasian population, ethnic variability in drug effectiveness and dose requirements is influenced largely by genetic polymorphism, metabolic enzymes, and receptors impacting both pharmacokinetic drug absorption, distribution, metabolism, excretion, and pharmacodynamics, drug response, and target size. And now we will talk about main mechanism and examples where those adjustments are frequently necessary. First of all, it's warfarin sensitivity mechanism variance is vacuole C1 gene, which affects the vitamin K epoxide reductase complex and cytochrome P2C9 enzyme responsible for warfarin metabolism are common among causians. Those adjustments, this polymorphism causes increased sensitivity to warfarin, leading to higher risk of bleeding and standard doses. Lower starting doses are often recommended with a frequent monitoring of international normalized ratio to individualized dosing. Codeine and other opioids mechanism variation in the cytochrome P2 D6 enzymes, which metabolize codeine to its active form morphium, lead to different metabolizer stages. Codeines have a notable prevalence of both poor or ultra-rapid metabolizer. Those adjustment poor metabolizers, these individuals may experience insufficient pain relief from codeine and may require alternative analgesics. And ultra-rapid metabolizers, these individuals convert codeine to morphine too quickly, increasing the risk of toxicity and adverse effects, including respiratory depression. Lower doses or alternative pain medication may be needed. Proton pump inhibitors mechanism variants cytochrome P2C19 impact the metabolism of proton pump inhibitors like omeprazole and esomeprazole, which are commonly used for acid-related disorders. Dose adjustment, poor metabolizers, causes who are poor metabolizers cytochrome 2C19 retain proton pump inhibitors in this system for longer duration, achieving higher plasma levels. These patients often benefit from standard or even reduced dose to maintain therapeutic effects without increasing side effects. Rapid metabolizer, some causes with rapid cytochrome P2C19 metabolism may require higher doses of proton inhibitor proton pump inhibitors to achieve effective and acid suppression. Beta blockers mechanism difference in beta adrenergic receptor function as well as variation cytochrome P2D6 influence the metabolism of beta blockers such as metoprolol. Dose adjustment. Poor metabolizers reduce cytochrome P2D6 activity can lead to higher plasma level of beta blockers, increasing the risk of side effects like bradycardia. Lower doses may be required to balance efficacy and tolerability. Rapid metabolizers, individuals with ultra-rapid cytochrome 2D6 metabolism may need higher doses to achieve the desired therapeutic effect, particularly in treating hypertension or heart failure. Statins, mechanism polymorphism acylCO1B1 encoding the OATP1B1 transporter affects statin transport to the liver and increase the risk of statin-inducing myopathy. Dose adjustment, reduced function variants, causes with reducing function CLC1B1 variants may be at higher risk for muscle toxicity with standard statin doses. Lower doses of switching for statin with a lower myopathy risk, such as pravastatin or fluvastatin, can be beneficial. Clopidogrel, antiplatelet agent, mechanism variants in cytochrome P2C19 affects the deactivation of clopidogrel, leading to reducing efficacy in individuals with loss of function alleles. Dose adjustment, poor metabolizers, causes with poor cytochrome P2C19 metabolism may have suboptimal platelet inhibition with standard clopidogrel doses, increasing the risk of cardiovascular events. This patient may require alternative agents like plasogrel or ticagrelor they do not rely on cytochrome 2C19 for activation. Thiopurines, azathioprine and mercaptopurin, azathioprine, mercaptopurin, mechanism variants in thiopurine methyltransferase affect the metabolism of thiopurines, commonly used in autoimmune diseases and cancer. Dose adjustments for metabolizer causins with low TMP, theoporine methyltransferase activity are at higher risk of drug toxicity, including myelosuppression. These patients require significantly reduced dose of thiopurines for alternative therapies. ACE inhibitors and hypertension medications. Mechanism variants affecting the renin-angiotensin aldosterone system may alter response to ACE inhibitors, which are widely used to treat hypertension and heart failure. Dose adjustment. Some causes may be responsive to ACE inhibitors and other populations often require standard doses. However, genetic testing and blood pressure monitoring can help determine if dose adjustments are necessary for efficacy and safety. Ethnic-specific genetic testing in causes can help identify this common polymorphism, enabling clinicians to personalize dosing strategies. This approach maximizes drug efficacy and minimizes adverse reaction. Statins mechanism polymorphism in uh, now we will talk about ethnic variability and mechanism in drug effectiveness with different doses, and it will be for African population, black population. For black population, ethnic variability in drug effectiveness and dose requirements is influenced by genetic and physiological difference in drug metabolizes enzymes transporters and receptors. This difference often necessitates dose adjustment to optimize therapeutic efficacy and minimize adverse effects, particularly in treatment related to hypertension, cardiovascular disease, and certain genetic condition. Antihypertensive mechanism. African population, black population typically have lower renin levels, which affects the renin-angiotensin-aldosterone system response. This leads to a reduced response of renin-angiotensin-aldosterone system targeting drugs such as ICE inhibitors and angiotensin receptor blockers. Dose adjustment, diuretics, calcium channel blockers, they are often more effective first-line agents for hypertension in African black individuals, which standard doses provided good control. ACE inhibitors, if ICE inhibitors or angiotensin receptor blockers are used, higher doses may sometimes be required or they may need to be combined with diuretics or calcium channel blocker to achieve the desired blood pressure reduction. Beta blockers mechanism. Black population, African population often have genetic difference affecting beta adrenergic receptor function and cytochrome 2 D6 metabolism, which can alter beta blocker effectiveness. Dose adjustment, beta blockers, reduced efficacy of beta blockers in some African black patients means the standard doses may be less effective in blood pressure management. Alternative combination therapy with diuretic or calcium channel blocker may be more effective than increased beta blocker dose alone. Warfarin mechanism variability in cytochrome P 2C9s evacuate C1 genes, which influence warfarin metabolism and sensitivity, is slower in African black population than in Caucasians and Asians. However, some unique variants in these genes, such as cytochrome 2C9, 5, 6A, and 11, after affect warfarin doses. Dose adjustment. Black patients may require high initial doses of warfarin compared to Causians to reach therapeutic INR levels. Genetic testing can help identify unique variants to tailor doses more accurately. Clopidogrel antiplatelet agents mechanism. Clopidogrel activation relies on cytochrome 2C19, but cytochrome 2C19 polymorphism that reduce function and less common in African black population compared to Asians. However, other metabolic pathway and genetic factors, including platelet receptor variation, can influence clopidogrel effectiveness. Dose adjustment. Standard doses of clopidogrel may be effective in most African black patients, but genetic testing can be considered in causes of reducing efficacy of higher cardiovascular risk. Alternatives such as plasogrel and ticagrelol may be recommended if reduced platelet inhibition is observed. Opioids codeine mechanism. Genetic variability in cytochrome 2D6, which metabolizes codeine into morphine, influences opioid response. In black populations, there is notable prevalence of ultra-rapid and poor metabolizer. Dose adjustment. Ultra-rapid metabolizer patients who are ultra-rapid metabolizers may have a heightened risk of morphine toxicity at standard codeine doses. Alternative non-opioid analgesics or carefully monitor and lower doses may be recommended. Poor metabolizers. Poor metabolizers may experience reduced pain, relief from codeine, and may benefit from alternative pain management options. Antidepressant, for example, citrulline or tricyclic antidepressants. Mechanism. Genetic variation in cytochrome P2D6 and cytochrome 2C19 impact the metabolism of antidepressants, leading to variability in response to tolerability. Dose adjustment. Cytochrome 2D6 poor metabolizer, African black patient with reduced cytochrome P2D6 activity may experience increased blood level and side effects at standard doses of SSRIC, citrulline, or tricyclic antidepressant. Lower doses can provide adequate therapeutic level while reducing adverse effects. Cytochrome 2 D6 ultra-rapid metabolizer patient with increased cytochrome 2D6 activity may require higher doses to achieve effective symptom relief, so alternative therapies may be more suitable. Statins mechanism variant in SLC1B1, which affect hepatic uptake of statins, are less common in black population compared to Caucasians. However, pharmacokinetic difference still play a role in statin metabolism and response. Dose adjustment. Generally, standard doses of statins are effective for Africans black population, but they may experience different side effect profiles. In cases of myopathy, risk of or adverse effects, dose adjustment or switching to lower risk statins, pravastatin or fluvastatin, may be warranted. Glucose 6 phosphate dehydrogenase deficiency mechanism. Glucose 6 phosphate dehydrogenase deficiency, which is more prevalent in individuals of African descent, can cause hemolytic anemia when exposed to certain drugs like sulfonamides, antimalarials, and some antibiotics. Dose adjustment. Patients with glucose 6 phosphate dehydrogenase deficiency can require careful selection of medication, and alternative drugs could be used where possible. If a drug with hemolytic potential is necessary, it should be given at the lowest effective dose with close monitoring for signs of hemolysis. ICE inhibitor inducing angioedema mechanism. African population have a higher incidence of IC inhibitor-induced angioedema due to genetic variation affected bradykinin metabolism. Dose adjustment. Given the increased risk, some clinicians may prefer starting African patients on other classes of antihypertensives like calcium channel blockers or diuretics. If ICA inhibitors are used, close monitoring is essential and immediate discontinuation is required as a first sign of angioedema. Summary. Ethnic variability in drug response among African Black population highlights the importance of individualized treatment strategies. Factors such as genetic polymorphism, physiological characteristics, and predisposition to certain conditions guide optimal dosing. Genetic testing can aid in tailoring therapy to achieve better efficacy and safety outcomes, especially for drugs with narrow therapeutic window or higher risk of adverse effects. We now talking about another ethnic variability in mechanism drug effectiveness doses in different populations. We will talk about Koreans. In Korean population, certain genetic polymorphism, particularly cytochrome P2C19, significantly impacts the efficacy and dosing of specific medication comparing to Caucasian population. This difference necessitate tailored dosing strategy to ensure the drug safety and therapeutic effectiveness. Clopidogrel, antiplatelet agent, a higher prevalence as a mechanism 2 and 3 alleles more among Koreans results a greater proportion of poor metabolizer. These variants reduce the enzyme activity, leading to less activation of clopidogrel, an antiplatelet drug that require metabolic conversion to become active. Dose adjustment. Poor metabolizer for individual with this cytochrome P2C19 variant, standard doses of clopidogrel may not achieve adequate platelet inhibition, increases the risk of cardiovascular events. Alternative agents such as plasogrel and ticagrelor, which do not rely on cytochrome P2C19 for activation, are recommended for effective antiplatelet therapy in poor metabolizer. Statins, cholesterol-lowering agents, mechanism. Koreans, like other East Asian population, tend to exhibit higher plasma levels of statin due to difference in drug metabolism and transport mechanism, which can increase the risk of dose-related side effects and muscle toxicity, myopathy. Dose adjustment, lower starting doses to minimize the risk of myopathy and other dose-related adverse effects. Koreans may benefit from lower starting dose of statin comparing to Caucasians. Starting with the lower doses and gradually adjusting as needed can achieve therapeutic goals while reducing the risk of muscle toxicity. Antidepressant mechanism. The cytochrome P2C19 polymorphism also affects the metabolism of certain antidepressants, such as selective serotonin reuptake inhibitors, leading to slower drug clearance and poor metabolizers. Dose adjustment. Reduce the dose for poor metabolizers. Koreans who are in poor metabolizers may require lower doses of serotonin reuptake inhibitors, selective serotonin reuptake inhibitors, to avoid excessive drug accumulation, which can lead to increased side effects such as nausea, sedation, and other adverse effects associated with selective serotonin reuptake inhibitors starting at a lower dose and titrated as needed can help achieve therapeutic level safety. Proton pump inhibitors. This higher prevalence of cytochrome P2C19 polymorphism also affects the metabolism of proton pump inhibitors, omeprazole, lansoprazole, leading to prolonged drug action and poor metabolizers. Dose adjustment, lower standard doses for prolonged effect encouraged who are poor metabolizers, standard or even reduced doses may be sufficient, or proton pump inhibitors may be sufficient to achieve effective acid suppression as the drug remains in the system longer due to slower metabolism. Summary: in Korean population, cytochrome 2C19 polymorphism impact the metabolism effectiveness of clopidogrel, ceton antidepressant, and proton pump inhibitor, while pharmacokinetic difference in statin metabolism increase the risk of myopathy. Personalized dosing strategies, including lower starting doses or alternative therapies, help optimize drug efficacy and reduce side effects in this population compared to standard doses typically applied in Caucasian population. Chinese population, ethnic variability and mechanism drug effectiveness with different Chinese population. In Chinese population, ethnic variability in drug effectiveness is often influenced by specific genetic polymorphism that affect drug metabolized enzymes and receptors. This difference can lead to varying drug efficacy and safety profiles compared to other populations such as Caucasians. Commonly, adjustment in dosing are necessary to certain medication to optimize therapeutic effects and minimize adverse reactions. Clopidogrel antiplatelet agent mechanism. Many Chinese individuals carry out cytochrome P2, C19, 2, and 3 alleles will reduce the enzyme's ability to activate clopidogrel. Dose adjustment, poor metabolizer, due higher prevalence, cytochrome P2, C19 poor metabolizer, clopidogrel may be less effective in Chinese patients, increasing the risk of cardiovascular events. Alternative antiplatelet agents such as prasugrel and ticagrelor, which do not require cytochrome 2C19 for activation, are recommended for individuals with this polymorphism. Warfarin, anticoagulant mechanism, genetic variants of VK or RC1 and cytochrome 2C9, which are prevalent in Chinese population, increase sensitivity to warfarin, resulting in greater anticoagulant effect. Dose adjustment should be administered lower starting dose. Chinese patients often require lower initial doses of warfarin compared to Caucasians to avoid bleeding risk. Regular INR monitoring is essential to personalize the dose and maintain a safe therapeutic range. Statin, cholesterol lowering agents mechanism. Higher plasma levels of statin absorbed in East Asian population, including Chinese individuals, due to variation in the metabolic enzymes and transport proteins. Dose adjustment. Lower doses to reduce myopathy risk. Chinese patients may benefit from lower starting doses of statin to reduce the risk of myopathy and other side effects. Adjusting the dose gradually based on lipid lowering response and tolerability is advisable. Proton pump inhibitors mechanism. The higher prevalence of cytochrome P, cytochrome 2C19 poor metabolizer among Chinese patients affects the metabolism of proton pump inhibitor, omeprazole and esomeprazole, leading to prolonged drug effects. Dose adjustment. Lower standard doses for sustained effects for Chinese patients who are poor cytochrome 2C19 metabolizer, standard or even reducing dose. Proton pump inhibitors may be effective due to prolonged drug action. Lower doses can minimize side effects while still providing effective acid suppression. Opioids, codeine, mechanism variants in the ORME1 gene and cytochrome 2D6 enzyme affect the metabolism and sensitivity to opioids. Dose adjustment. Potential for lower adjustment doses. Chinese patients with certain OPRME1 variants may be more sensitive to opioid, necessitated lower doses to avoid side effects such as respiratory depression. For codeine, lower doses or alternative analgesics may be considered, especially for those with reduced cytochrome 2 D6 activity. Antidepressant mechanism cytochrome 2 C19 polymorphins common in Chinese population influence the metabolism of CCRIS, selective serotonin reuptake, and leading to slower clearing and poor metabolizers. Dose adjustment, lower statin doses. Chinese patients who have poor cytochrome 2C19 metabolizers may benefit from lower starting doses of CCRIC to avoid excessive drug levels and associated side effects such as sedation and gastrointestinal disturbances. Carbazepine antiepileptic mechanism HLA-B1502LL, common in Chinese population, associated with a severe risk of Stevens-Jones syndrome when used carbamazepine. Dose adjustment, alternative therapy, avoidance of carbazepine. Genetic testing is recommended before prescribing carbazepine. If the HLA-B1502 allele is present, alternative antiepileptic drugs are preferred to avoid the risk of life-threatening skin reaction. Summary: Chinese population specific genetic polymorphism is cytochrome P2C19, cytochrome P2C9, VKOR C1, and HLA-B significantly influence the metabolism and effective medications such as clopidogrel, warfarin, statins, proton pump inhibitors, opioids, and carbazepine. Personalized treatment through genetic testing and dose adjustment can optimize drug efficacy and reduce adverse effects, ensuring safer and more effective therapies tailored to this population. Indians. Ethnic variability and mechanism drug effectiveness in Indians. In Indians population, ethnic variability in drug effectiveness and dosing requirements is influenced by genetic polymorphism affecting key drug metabolizing enzymes and receptors. This genetic variation often lead to difference in how drugs are processed and responded to impacting drug efficacy and safety. Tailored doses for specific medication is essential to optimize therapeutic outcomes and minimize adverse effects. Warfarin, anticoagulant mechanism, variants of AKORC1 and cytochrome 2C9 are common in Indian population, affecting warfarin metabolism and increasing sensitivity to its effects. Dose adjustment, lower starting dose. Due to increasing sensitivity, Indian patients often require lower starting doses of warfarin to avoid bleeding risk. Regular INR monitoring helps in personalizing the dose and maintain a safe therapeutic range. Clopidogrel antiplatelet mechanism. Many individuals of Indian ancestry carry cytochrome 2, C19, 2 and 3 alleles, leading to reducing conversion of clopidogrel to its active form. Dose adjustment, alternative antiplatelet therapy for cytochrome 2, C19 poor metabolizers, standard doses of clopidogrel may not provide adequate platelet inhibition. Alternatives like plasogrel or ticagrelor, which do not depend on cytochrome 2C19 for activation, are preferred for effective antiplatelet effect. Statins, cholesterol-lowering agent. Mechanism variation in SLO, CO1B1, and other transport proteins can influence the metabolism of statins, impacting the risk of side effects, particularly myopathy. Dose adjustment, lower starting doses. Indian patients may require lower starting doses of statin to reduce the risk of myopathy. Titrating doses based on lipid-lowering response and tolerability helps optimize therapy while minimize side effects. Proton pump inhibitors mechanism, the higher prevalence of cytochrome P2C19 poor metabolizer among Indian population affects the metabolism of PPIC, leading to prolonged drug action. Dose adjustment. Lower standard doses for sustained effects. Standard or reduced doses of proton pump inhibitors may be effective in Indian patients who are poor cytochrome P2C19 metabolizer, as these patients experience prolonged drug effects leading to sustained acid suppression with lower doses. Carbazepine antiepileptic drug mechanism. The HLA-B1502 allele present in some individuals of Indian ancestry is associated with a higher risk of Stevens-Jones syndrome, which taking carbazepine. Dose adjustment, alternative therapy, avoidance of careful monitoring, genetic screening of SLAB1502 is advised before prescribing carbazepine. If this allele is present, alternative antiepileptic medication are preferred to prevent serious adverse reactions. Antidepressants mechanism cytochrome P2C19, cytochrome P2 D6 polymorphism prevalent in Indian population affects the metabolism of antidepressant, impacting drug clearance and response. Dose adjustment. Reducing dose for poor metabolizers. Indian patients who are poor metabolizer may benefit from lower doses of CCRIC and tricyclic antidepressant to prevent excessive drug accumulation and side effects. Careful titration low for safe and effective therapy can be needed. Opioids, codeine, mechanism variant of cytochrome P296 impacts the metabolism of codeine to morphine, affecting opioid efficacy and safety. Dose adjustment, personalized dose. Patients who are poor metabolizer may experience reduced pain relief from codeine and might need alternative analgesics. Conversely, ultra-rapid metabolizer could require lower doses to avoid morphine toxicity. Thiopurine, azothioprine, and mercaptopurine mechanism. Polymorphism in thiopurines, thiopurine methyltransferase impacts the metabolism of thiopurines commonly used for autoimmune diseases and certain cancers. Dose adjustment. Lower doses for poor metabolizer. Patients with reduced methylpurine methyltransferase can, with activity, are at risk of myelosuppression and other toxicities with standard thiopurine doses. This patient requires significantly reduced doses or alternative treatment. Beta blockers, metoprolol, mechanism. Variation of cytochrome 2D6 affects the metabolism of beta blockers, influence the drug levels and response. Dose adjustment. Lower or higher doses based on metabolism. Indian patients who are poor cytochrome 2D6 metabolizers may require lower doses of beta blockers to avoid side effects, while ultra-rapid metabolizers may need higher doses or alternative agents to achieve optimal blood pressure and heart rate control. In Indian population, specific genetic polymorphisms such those cytochrome 2C19, cytochrome 2C9, VQRC1, CLC1B1, thiopurines, and HLA thiopurine methyltransferase and HLA-B influence the metabolism and effectiveness of drugs like clopidogrel, warfarin, statin, proton pump inhibitors, antidepressant, and carbazepine. Personalized medicine approaches, including genetic testing and dose adjustment, can enhance drug safety and efficacy, providing better therapeutic outcomes for Indian patients. In Indian population, variation in drug transport, particularly in organic cation transporter or CT1, can influence the uptake and effectiveness of metformin, a commonly prescribed drug for managing type 2 diabetes. The transporter variation can impact metformin bioavailability and therapeutic efficacy, potentially necessitated dose adjustment to achieve optimal blood glucose control. Mechanism. OCT1 transporter variants plays a significant role in metformin uptake in liver cells, where the drug exerts its glucose-lowering effect by reducing hepatic glucose production. Variants in OCT1 can lead to reduced transporter activity, affecting metformin's absorption into liver cells and diminishing its effectiveness in lowering blood glucose. Other transporter variants, additional transporters such as CT2 or MAT1, may also influence metformin's pharmacokinetics and renal elimination. Also, the impact of these variants is generally less pronounced than OCT1. Dose adjustment in Indian population. Reducing efficacy. Individuals with reducing function with CT1 variants may experience suboptimal glycemic control or standard metformin doses due to decreases uptake in the liver. This patient might benefit from higher doses. Gradual dose increases of metformin may be needed to achieve effective blood glucose control. However, this must be carefully monitored to avoid gastrointestinal side effects. Alternative for adjunct therapy in cases where dose increases are not effective or well tolerated. Additional alternative diabetes medication may be necessary to achieve target glucose level. Increased gastrointestinal side effects. Some individuals with transporter variants may also experience a greater incidence of gastrointestinal side effects, such as nausea, due to increased concentration and metabolized metformin in the intestines. Low initial doses and gradual titration, starting with lower doses and gradually titrated upwards, can help improve tolerability and reduce side effects. A clinical recommendation. Genetic testing for Indians, also not yet routine genetic testing for CT variants, can provide insight into potential metformin responsiveness and help guide dose and decision in Indian patients. Monitoring glycemic response. Regular monitoring of blood glucose levels and HbA1c is essential to assess the effectiveness of metformin and determine if dose adjustments are needed. Consideration of combination therapy. If metformin alone is insufficient, combine it with other oral hypoglycemic agents such as CGLT2 inhibitors or DPP2 inhibitors may help achieve better glycemic control without necessitating excessively higher doses of metformin. In Indian population, genetic variants affecting ACT1 and other transporters can influence metformin uptake and efficacy. Adjustment in dosing, careful titration, and consideration of combination therapy may help overcome these challenges, ensuring effective diabetes management when tailored to the individual's genetic profile and response to treatment. Now we will talk about Middle East population, ethnic variability and mechanism drug effectiveness with different doses in Middle East population. Middle East population, the higher prevalence cytochrome P2D6 and cytochrome P2C19 polymorphism significantly affects the metabolism and efficacy of various drugs, including antidepressant, antiplatelet, and opioids. Additionally, variation in COL1B1 transfer impacts statin metabolism, necessitating adjustment in doses for safety and efficacy. Clopidogrel antiplatelet agent mechanism. Many individuals in Middle East population carry cytochrome P2C19 2 and 3 alleles will reduce the enzyme's ability to convert clopidogrel to the active form, leading to a decreasing antiplatelet effect. Dose adjustment, alternative therapy. Due to higher frequency of poor metabolizer, clopidogrel may not provide sufficient platelet inhibitor in standard doses. Alternatives such as plasogrel and ticagrelor, which do not rely on cytochrome P2C19 for activation, are preferred in poor metabolizer to achieve effective antiplatelet action and reduce the risk of cardiovascular events. Statins, cholesterol-lowering agents, mechanism. Variation in the CLC1B1 gene, which encodes the QRTP1B1 transporter responsible for hepatic uptake of statins, associated with increased risk of statin-inducing myopathy. Dose adjustment. Lower starting dose. To mitigate the risk of myopathy, lower starting doses of statins are often recommended. the Middle Eastern individuals with LC1B1 polymorphism. Gradual dose titration based on lipid response tolerance may help optimize therapeutics outcomes, which minimize the risk of muscle-related side effects. Statin selection. In case with significant myopathy risk, alternative statins like pravastatin or fluvastatin with are less dependent on CLC1, B1 transport be a safe option. Antidepressant, antidepressant. Um, Cytochrome P2D6 and cytochrome P2C19 polymorphisms, common in Middle Eastern population, influence the metabolism of variation antidepressants. Cytochrome P2D6 poor metabolizers, particularly, may experience higher drug levels and increased risk of side effects with standard doses of certain antidepressants. Dose adjustment. Lower or tailored doses. Individuals who are poor metabolizers, cytochrome 2D6 or cytochrome 2C19 may require lower starting doses of antidepressant to avoid side effects like sedation, dizziness, and gastrointestinal disturbance. Dose titration and careful monitoring help maintain therapeutic effectiveness without adverse effects. Opioid. Cadein mechanism cytochrome P2D6 polymorphism affect cadein metabolism, influenced how rapidly it's converted to morphine. Middle Eastern population include both ultra-rapid and poor metabolizers, creating variability in cadein response and safety. Dose adjustment. Alternative analgesics. Ultra-rapid metabolizer may experience toxicity at standard doses of cadein, while poor metabolizer may experience reduced pain relief. In both cases, alternative pain medication, non-opioid analgesics, or alternative opioids that do not depend for activation may be preferred. Middle Eastern population exhibit higher variability of drug metabolism due to cytochrome 2D6, cytochrome 2C19, SLC1B1 polymorphism. Personalized doses, including the use of alternative medication, lower starting dose of specific drug selection, can enhance drugs' efficacy and reduce the risk of adverse effects in the population. Genetic testing, where available, support precision medicine and more effective treatment tailored to individual genetic profiles. Latino and Mexicans, ethnic variability in mechanism drug effectiveness. In Latino and Mexican population, diverse genetic background contribute to variability in drug metabolism, especially in genes such cytochrome P2C9, cytochrome P2C19, EVIC-C. This genetic variation affects the effectiveness and safety of medication, particularly anticoagulants, antihypertensives, and antiplatelet agents. Tailored doses and selecting alternative medication when necessary can help achieve optimal therapeutic outcomes and reduce adverse effects. Warfarin anticoagulants mechanism variants in the VQRC1 gene, common in Latino population, increase sensitivity to warfarin, leading to an elevated risk of bleeding with standard dose. Dose adjustment, lower starting dose. Due to increased sensitivity, lower initial dose of warfarin are often recommended for Latino patients. Careful monitoring of the international normalized ratio is essential to adjust dosing and prevent bleeding complications, ensuring the dose is personalized based on individual response. Clopidogrel, antiplatelet agent. Mechanism many Latinos and Mexicans carry cytochrome P2C19 2 and 3 alleles, leading to reduced enzyme activity and decreased conversion of clopidogrel to its active form. This results of suboptimal platelet inhibition and standard doses. Dose adjustment, alternative therapy. For patients with reduced cytochrome P2C19 function, clopidogrel may be less effective in preventing cardiovascular events. Alternative antiplatelet agents such as prasugrel or ticagrelor, which do not rely on cytochrome C19 for activation, are preferred in poor metabolizer to achieve effective platelet inhibition. Antihypertensive, similar to block population, Latinas or Mexicans may have a lower response of ACE inhibitors, possibly to lower renin levels, making other antihypertensive agents more effective in managing blood pressure. Dose adjustment. Preference for diuretic or calcium channel blockers. Diuretic and calcium channel blockers tend to be more effective as first-line treatment for hypertension in Latin and Mexican populations. These agents often provide better blood pressure control either as monotherapy in combination with other antihypertensive compared to ACE inhibitors. Antidepressant, CCRC, and tricyclic antidepressant mechanism. Variation in cytochrome 2C19, cytochrome C9 affects the metabolism of antidepressant, influencing blood level and risk of side effects. Dose adjustment, lower of adjusting doses. Latino patients who are poor metabolized cytochrome P2C19, cytochrome P2C9 may require lower doses of citrulline or tricyclic antidepressant to avoid side effects like sedation or gastrointestinal disturbance. Individualized dosing and close monitoring help in achieving therapeutic efficacy with minimized adverse effects. Statin cholesterol-lowering agents mechanism variability in CLC1B1, a gene involved in statin transport, can lead to increased risk of myopathy in some Latinos patients. Dose adjustment, lower starting dose of alternative statin, lower starting dose of statin are often recommended to reduce the risk of muscle-related side effects. Alternatives like pravastatin or fluvastatin, which have a lower myopathy risk, may be suitable option for patients with at higher risk. In Latin and Mexico population, genetic polymorphism cytochrome P2C9, cytochrome PC19, and VQRC1 can influence the metabolism and effectiveness of medication like warfarin, clopidogrel, antihypertensives, and antidepressants. Adjusting doses and selected alternative therapy when appropriate can help improve therapeutic outcomes and minimize adverse effects. Genetic testing, where available, can further refine personalized treatment plan, enhance drug efficacy and safety tailored to each patient. Mediterranean population is the higher prevalence of glucose 6 deficiency, and VQRC1 variant significantly impacts the safety and efficacy of medication, particularly anticoagulants and antimalarials. These genetic factors, dose adjustments, and alternative treatments therapeutic efficacy. Warfarin anticoagulant mechanism variants VQRC1 gene common in Mediterranean population lead to increased sensitivity to warfarin. The genetic variation affects the vitamin K cycle, resulting in great anticoagulant effect and increased risk of bleeding at standard doses. Dose adjustment, lower starting dose. Patients with VQRC1 variant generally require lower initial dose of warfarin to prevent excessive anticoagulation and bleeding complication. Regular monitoring of the international normalized ratio helps in personalizing the dose and maintaining a safety therapeutic range. Primaquine, aceton antibiotic, sulfonamide, and nitrofurantoin, glucose 6-phosphate dehydrogenase deficiency is highly prevalent in Mediterranean population, can lead to hemolytic anemia when patients are exposed to certain medication. G6PD is an enzyme like protect glucose 6-phosphate dehydrogenase that protects red blood cells from oxidative stress and deficiency, increases vulnerability of drugs that induce oxidative damage. Dose adjustment and screening. G6PD screening before prescribing drugs known to trigger hemolysis or G6PD deficient individuals, such as primaquine, antimalarial and certain antibiotics, sulfonamide, nitrofurantoin. G6PD deficiency screening is recommended. Alternative treatment is adjustment dosing for individuals with glucose 6-phosphate dehydrogenase deficiency. Alternative medications that do not induce hemolysis should be considered. If these drugs are essential, carefully monitor low doses and close supervision for signs of hemolysis, fatigue, jaundice, and dark urine are advised. Other jaundice, dark urine advice. Other considerations of antimalarials, in addition to primacvine, other oxidative drugs will be used with caution in Mediterranean population due to risk of hemolysis. And that's intermifan and steroid NSAIDs, also general safe of glucose 6 phosphate dehydrogenase deficient individuals. Higher dose of steroids and NSAIDs or acetaminophen should be used with caution as they may induce oxidative stress within sensitive individuals. You see that how important to take into account ethnic variability and mechanism drug effectiveness. Dear colleagues, it's the second part of lectures. I'm very thankful for your attention. I'll be very thankful if you will subscribe on my YouTube channel Drug Safety from Galina Cordero, and you will find actual information. I'm working for you. Plus, if you will attend, then you will find interesting actual information. My son on medicine net. I am be very happy if you will attend my lectures because I'm trying to find actual information which will help to increase safety of patient. Thank you very much. Bye bye.